Gets me pumped. I'll end with this. What are you excited for about CFHA in the coming year?
I'm excited about a lot of stuff. COVID notwithstanding, of course. Every conversation these days is layered with that caveat of we don't know what the future will hold and how all this is going to wrap up. But I'm most proximally excited about just getting our community together. I can't tell you how energizing it is for me, and I know I get this feedback too from our members. It's just really nice to get together.
Yeah.
And I'm excited to get together, even though we have to do it virtually, which is a bummer. I was hoping to, bring you guys out to your homeland of Pennsylvania, even if it is on the other side of Pennsylvania, the wrong side.
We're okay with that. We were excited about it. Yeah, we were excited on the other side. Yeah.
So I'm just excited to get together and kind of commiserate a little bit and celebrate a little bit. I think we need to celebrate. Like, we've done a really good job of working our way through this situation. I know your clinic has been a bright spot from the very beginning. You guys really adapted your protocols and worked together as a team. That's what was so exciting about hearing what you guys were doing, because you could tell, like, this clinic is operating as a team. This is not just behavioral health as a siloed, separate department. They incorporated you guys from the very beginning. You guys were demonstrated your value from the very beginning, both to staff and to patients. A lot of clinics have had that experience and have bolstered their status, within their clinics as a result. So I think there'll be some time to celebrate, and also a time to commiserate a little bit, because it's been a tough year. Right? It's just been really, really hard for folks. And I think particularly in primary care, I really hope that getting together will be a little bit of a cathartic experience for people to rehash and to talk about what this has meant as far as changes in what they do day to day in primary care. Because it's been significant. I mean, we're sort of used to putting on our masks and washing our hands a bazillion times a day and, walking awkwardly down the hallway to make sure we have the right distance with our partners. And, but all those little changes have taken a little bit out of us. And so I'm looking forward to just getting together at our annual conference. And then I think beyond that, looking ahead to the coming year, I'm also really interested to see, I want to see what comes of all of this. I talked about in my story, I talked about how that moment, that crisis moment, created this creative space, right? Something like that's going to happen for us in healthcare, and hopefully those of us specifically in integrated care in the coming year, where that'll bring together, I think, the transformation that we need in healthcare, the innovation that we need in healthcare to take big, bold steps like a lot of us took at the beginning of this pandemic crisis, to take that the next step, right? To really begin to say, hey, let's reach out to our payers, really do something bold with regard to payment. Let's really dig deep on our teams and figure out how to really change our team so that our struggling primary care providers do feel like this is a different experience for them to come to work. Like, not just business as usual. Like, let's redesign the way we provide care, and make primary care really live up to its vision, right? I think there's going to be some interesting things that happen as a result of all that, really good things, hopefully. And then the other piece of that too, that I think is an energizing disruptor, is our national conversation on race. I think only good things are going to come of that. More patient-centered care, more trust, hopefully, between minority populations and our clinics, more cultural humility on the part of our primarily white healthcare workforce, and more cultural competence. And out of that, maybe some interesting ideas about how to really promote health in communities and change the way we engage patients for diabetes and hypertension and substance abuse care and all the areas where we have inequities. So it's going to be an exciting time, as ridiculously exhausting as this time is and as stressful as it is. something good's going to come of this. I don't know exactly what that is, but I do have that sense that much like my story where I didn't know I'd end up in primary care, who knows where we're going to end up as a healthcare system. The one thing I do know is that those of us who've been doing this kind of work, I think because we have a predisposition to change and we have a predisposition to being open about this, my hope is that we as integrators take advantage of that we're aware of it and work with it instead of working against it. So that's always been my encouragement whenever I talk to people these days. Just take advantage of the moment. This is a moment to not just sit back, but actually say, we can make some big, bold changes right now.
And I think, it's one of the things that, I remember Bridget saying this at the beginning of COVID, BHCs, we're used to this, right? Like we're used to this idea of like, we got to be flexible. We got to rethink about how we're approaching patients. And I think, as you said, with these two pandemics that we're dealing with, obviously COVID and then the systemic racism that we continue to just butt up against, and it's just becoming more of light. The one, really silver lining in this is really causing us to rethink everything. It's causing us to rethink how do we deliver healthcare. It's causing us to rethink what does it mean to be a healthcare system and a center, and how do we reach our patients. And I think that is neat. And BHCs, and particularly integrated BHCs, this is our bread and butter. Like this is, we're used to change. We're used to having to, be flexible and stuff. So I think we can also help our organizations become more comfortable with that, and have our organizations see that this can be okay. Like change isn't a bad thing. We can adapt to these things. So I just really express my appreciation, Neftali. Every single time I do consulting, every time that we do presentations, so we always end with go to cfha.net, get involved with Collaborative Family Healthcare. And I think that has, we always were like that, but definitely since, your more kind of formal involvement in the leadership, it's been growing exponentially. So thank you for that. I know a lot of people are just pumped. So yeah, my gratitude for it. And it's nice that we have some sports back. Basketball starts tonight, LeBron plays, so I'm excited. I know you're probably excited. It's the Mets, right?
Yes, I'm a Met fan. Yeah, I actually, I'm interested to see how Bridget responds to whatever happens. It's her reactions that keep me engaged more than anything else, because I know she flies high when they're doing well, and she flies low when they're not.
We're still living on the 2016 championship. Life, no matter what happens with life, it was because of that it was made. So my gratitude, man. I really appreciate it, and I'm definitely looking forward to the conference and everything that's going to come with that. So thank you again for the leadership and giving us some time today.
No problem. My pleasure.